Good morning, everyone, and thank you so much for joining us this morning for Population Health Collaborative webinar. So my name is Clement Nicia, and I am with Population Health Collaborative, and today's webinar is a discussion that we are going to have on how you can use our internal and as well as external data website, Keys to Health, for your community health assessment process that you're working on right now. So for those who do not know us, Population Health Collaborative is a regional population health collaborative group. Our work here is to connect groups of people to align resources and expertise. And with our partners in the community, we work together to actively work towards improving the population of the Western New York region. So before I jump into the actual webinar, some housekeeping items that I would like to mention and discuss. So this webinar right now is being recorded, and once it's done, it will be posted on our YouTube channel. A copy of the slides will also be posted on the Keys to Health website. And as we go along with the presentation and the discussion, I want this discussion to be as interactive as possible. So if you have any questions, you can type your questions into the Q&A box on the right-hand side of your WebEx screen. And we will do our very best to incorporate those questions into the discussion. So I wanted to get a sense, if you can please type into your Q&A box, I wanted to get a sense of what counties you represent or what counties you work in if you're joining us today. So I'll give people about 15 seconds to respond to this quick question so I can get a good sense of where people are working from and where people are coming from. So it looks like we have a good representation of all the counties in our region, and that's great, and that's good to see. We also have some counties extended from our 8 counties here, so we're very excited. Oh, and actually someone from New York City, so that's great, that's wonderful. So I'd like to thank all of you guys for joining us today. I like the representation that we're seeing. So I'm going to go ahead and another question that I have is, how many of you, if you can just type yes or no, are currently involved in a community health assessment, CHIP, or CSP process at this moment? So it looks like we have a mix of responses. Some no's and some few no's and some yeses. For the individuals who said no, thank you for joining us. I guess you really like listening to people talk about data. So thank you so much for joining us. Even if you're not part of the child process and you're still interested in participating in this presentation. So thank you once again. Thank you everyone for joining us this morning. So this is the agenda for our discussion today. So first, I would like to go into the timeline of a community health assessment. So based on the phases of the assessment and where your county or where your particular organization falls at this moment. Then we are going to get into an actual live demo of the Keys to Health website. In doing so, I'll be going through how you can get demographic information for your county, how you can also get data for your secondary analysis, as well as data to support your report that you'll be submitting to the state. And if we have time at the end, I will go through our, there's a community health assessment guide and a tool on the website that I'll go through briefly for the individuals who have already done the chart in the past or are currently doing charts right now. You probably have a sense of this guide, so I will not be going too much in depth into it, but I'd like to, if we have time at the end, go through that guide to give you a sense of how you can, step-by-step process of how you can go about your community health assessment process. And then if you have any questions at the end, I will take those questions. And as I said, if you have questions as we are having this discussion and conversation this morning, you can type your questions into the Q&A box, and my colleague here, Michael Navarro, is here with me, and he's going to relay those questions to me, and I'll do my very best to incorporate those questions into the presentation. So when it comes to a community health assessment planning timeline, I see this as a four-phase process. So in phase number one, what most counties and hospitals as well as CBOs wants to do is establish a community health steering committee. In doing so, that committee will review previous questions that you've used in the past for your child. You will finalize your child questions that you're going to use in this current process, and then you're going to outline a distribution list. And when I say distribution list, this is your target population that you want to distribute your surveys to. In phase two, that's when your survey distributions happen. So whether it's been done by paper format or it's been done online, you distribute your links to the general population to complete the surveys. During this phase, you also do your data collection. This phase is also where you conduct your demographic and secondary analysis, and that's where Keys to Health will really come into place later on in this discussion. You conduct your focus groups during this phase, your stakeholder conversations and discussions during this phase. And one thing that I've come across is a mid-survey data analysis. So if you have a specific timeline based on how many months you're collecting your data, somewhere in between the process, you do want to conduct a mid-survey analysis to see where the data is trending, and most importantly for your demographic information, so you can get a sense of who is responding to your surveys, and if there's any particular group of people that you like to target, then you can do a second push of your surveys. So that's when your intercept surveys comes around. So I guess your intercept survey is your second push to a group of people that you really like mostly to target. Then you finalize your survey data analysis. Then you convene your steering committee once again to review the child data that you have analyzed. In this phase as well, that's when you identify your priorities for your plan. So you identify your priorities for your community health improvement plans at this point. In phase three, you write your report that's going to be submitted to the state. Once again, you convene your steering committee to review your report. And while in this phase as well, you continue to identify your priorities for your plans as well. In phase four, which I consider to be your final phase, is when this is a joint effort between the CBOs, the local health departments, and our health systems. The health systems have to seek board approval before the report is submitted to the state. So this is where, in this phase, where you will seek your board approval to review the report before it's submitted to the state. And finally, you submit your child and chip to the state for review. So if you are currently in the phase of your child, then based on where you are, most people should be in phase two, where your surveys are already distributed. If it's a joint effort between the, as I said, between the local health department and the hospitals do have an IRS requirement that at least 50% of the process has to take place in 2019. So perhaps some hospitals haven't distributed the surveys yet, but in most cases, the local health department should be in this phase of at least finalizing your questions for distribution. So very often in our survey questions, one of the things we try to identify is the top concerns and issues that the community face. And very often there's a question in there that asks the community, what is the top 3 conditions that you think you face individually or the community faces, and this is where most of our community of our hospitals and local health departments pull their priorities from. Now, if we take a look at the top 3 issues facing our region, so I visited the New York State website to look at the leading cause of death and what are the top 3 conditions facing our region. The number 1 issue is heart disease. The number 2 issue is cancer, and number 3 is chronic lower respiratory condition. So these 3 conditions are the top 3 conditions that problems that we face in our region. Based on your survey and the answers that you get from your community, these might be some of the conditions that you identify as your top priorities and your top 3 problems. So I wanted to show this graph and this chat, and moving forward, use these three conditions as an example of how you can pull data out of Keys to Health to support your report. So, for instance, so I'm going to jump into the website. The address to the website is k2hwny.org. So this is our website, Keys to Health. We have a lot of resources on this website other than just data. So I would like to take a minute or two to go over the overview of the website. So in the homepage, we have 4 tabs here. Our dashboard tabs, which is the tab where you're going to find, if you're looking for data, that's where you're going to go to find data. We have our Western New York reports. So we have our community health needs assessments reports. Some are published up here. We have local reports that we also publish on the site, and as well as a resource tab with some the community health assessment guide that I'm going to go through, if we have time, I'm going to go through later, and as well as finding grants opportunities. So if I would like to mention that if you need Keys to Health updates, you can always visit the site and visit this link and input your information and submit it to us, and we'll be in touch with you in regards to updates. So what we like to do every month on the site is to pick a condition or a problem that we face in the community and put a spotlight on that problem. So this month we did Diabetes Month. So we provide some information regarding diabetes in terms of the prevalence and the incidence in the state as well as in the country. And then we provide some indicators that support the focus on. So in this case, we provide some death rates as it relates to diabetes, ER rates as it relates to diabetes, and hospitalization rates as it relates to diabetes. And then in the middle here is a graph, and as well as a rate that represents, in this case, representing Erie County as one of our 8 counties. And there's a map here that shows where your county may fall, along with a legend that tells you whether you're doing bad, you're doing good, based on the rate. At the bottom of the page is a community spotlight, and this is my favorite. My favorite part of the site is the community spotlight. So, as an organization, as an agency, if you have any program going on that you would like for the community to know about, you can let us know, and we can publish that information on our community spotlight. Usually, each month we try to highlight at least 3 programs that's going on in the community, whether it's locally or regionally or countywide. So as an agency or as an organization, if you have any programs going on that you'd like the community to know about, you can certainly reach out to us, and we will put a spotlight on that program. So getting into how you can get data to support your report and as well as your community health assessment process. So as I mentioned, if you go into dashboard, the first option that you see is find health data. So if you select that option, it brings you to this page where you can search for data in several ways. At this point, in three basic ways. You can either search for a condition here in this search by keyword, or you can find an indicator by going through this long list of indicators, about 200 plus indicators, or you can find indicator based on location. So regionally, by county, by census city, census place, in this case city, and census tract, and as well as zip code level information. So to make things a lot easier, what I often recommend people to do is to input a keyword and see what options you're provided in terms of the response. So as I showed previously, was the top three conditions that we face, or the leading cause of death that we face in the Western New York region. And the first condition that I highlighted was heart disease. So I would like to use heart disease as the example here for indicator that I would like to use to search for data. So if I select the option for search by keyword, I can simply just type in heart disease. And once again, you can stop me at any moment with questions. You can type in a question, and as I mentioned, I will incorporate those questions into the presentation. You don't have to wait till the end of this discussion to ask questions. So if you enter heart disease, if you enter heart disease, the page that will show up will provide you with several indicators as it relates to heart disease. So as you can see on this page, we have several indicators that may relate to heart disease. So you might have some conditions and factors that contribute to heart disease. So in this particular case, since I'm using heart disease, the indicator that I would like to focus on is age-adjusted death rate due to coronary heart disease. Now, once you select that indicator, you will get another box with the name of the indicator, the rate at which the indicator is being measured, and as well as if you can find that information on the regional level or county level. If you want to be specific in your selection, you can choose the select a location tab, and you can get a pull down of the options as to what level of the information you can get. At this point, we have regional information and county information, and I will use Chautauqua as an example for this demo. So if you select Chautauqua, or based on your county and where you are, if you select your county, this page will be displayed. Once again, you want to make sure that you are at the page of the indicator you're looking for. So we selected age-adjusted death rate due to coronary heart disease. It provides you the county name, the measurement period. In this case, the period that we are looking at is 2014 to 2016. And it provides you information as to at what level that information is being provided, at what measurement. So we are looking at this death rate level at a per 100,000 population. The page also provides you some information as to why this emphasis on this information is important, and you can always click on more to read about the condition. So I guess what people would be most interested is the actual rate. So this box here in the middle, once again, provides you with the county and the county name that you're searching. This number here is the rate that you would be looking for or you would be searching for. So in Chautauqua, the age-adjusted death rate due to coronary heart disease is about 123 deaths per 100,000 population. So this is our rate. To the right-hand side of the page, it provides you with some comparison values. So New York State values comparison, U.S. State, New York value, and as well as the prior value of the county, the trend, and in which direction this condition is going. And here is a Healthy People 2020 target rate. So if you take a look at this chart, you can see a graph here that shows the trend of coronary heart disease death over some years now. So from 2008 to 2016 for Chautauqua County, as you can see, the rate, well, in most sense, since 2011 has been going down. So whatever works and projects and intervention programs that the county of Chautauqua is doing, this is a great accomplishment in terms of looking at the rate since 2011 to see such a good drop in value. Now, the reason why this graph here is very important is because once you complete your survey, your community health assessment survey, and you identify your top 3 problems, if health disease is one of the conditions, if health disease is one of your top 3 conditions, and you search for the data on keys to health, if you want to build support and reference into your report, you can use this measure here to do that. So you can say that, since 2011, the county has been doing really well in terms of whether educating the public or implementing programs that is helping the public reduce the rate of heart disease deaths. So this graph here really tells you a story of how well your county is doing over the last 8 to 10 years or so. I can see that we have a question here. So the question reads, I see that we have CDC a source of data. Is this only for state and U.S. data or also county level data? So to answer your question specifically, yes, CDC is the source here, and we do have data that reflects both the state and the U.S. one. We don't on this site. We do have the values for New York State because in most cases that's our comparison rate. And we have the county level information is the ones that usually you can identify when you come to this site to get that information. So yes, we have the New York value rate, we have the county rate, the U.S. rate. Not always. If it's a comparison value, then yes, it would be identified on this site. So going back to our graph here, at the bottom of this line graph is a breakdown of how the condition coronary heart disease death falls within a breakdown of our gender population. So as we can see here, our male population in the red bar in Chautauqua County is both higher than our female population and the overall population of Chautauqua. So some work needs to be done when it comes to our male population in terms of deaths as it relates to heart disease. And as you can see, whenever you put your cursor on any of these bar graphs or these line graphs, it gives you the rate of that specific bar or line graph. So for our male population, it reads that roughly about 158.6 men in Chautauqua County die from coronary heart disease per 100,000 population. So this is a great way of a great way to visit the site and get the data that you're looking for. Now, once more, if you place your cursor on any of these charts here, there's these three icons that show up, which I just learned last week that is called a hamburger. So if you place your cursor on this hamburger, I do not mean to get anyone hungry in here, but if you place your cursor on this hamburger, you can expand the menu and you can download this graph as a JPEG or as a PDF. So this also gives you an opportunity to capture this graph and include the graph into your report. So there is a lot of symbols and icons and legends here on the page. And if you're ever confused by what any of these icons and symbols mean, to the left-hand side of the screen, there's a tab here that says "See the legend." Now you can click this legend to expand it. Once you expand this legend, it provides you an explanation of what each and every icon means. So if the arrow is green and trending up, that means your condition is trending up. And based on the color, it will tell you if you're doing bad or if you're doing well. So you can always fall back on this little tab here to get a sense of what the icons are telling you or what the legends are telling you. So at the bottom of the page here, what the page also does is gives you a comparison rate. And since we are in Western New York, we get a comparison rate for the other 7 counties as well. So in this case, we specifically selected Chautauqua as the county of interest. What this bar graph here does, it gives you all the rates for the other 7 counties. So in comparison to, for instance, Cattaraugus, how is Chautauqua doing? So there is more deaths in Cattaraugus in comparison to Chautauqua when it comes to coronary heart disease. And it looks like in our region, Allegheny is the county that's doing the best when it comes to coronary heart disease rates. Right below the bar graph is also a table if you like to see it in a table format, and if it makes it a lot easier for you to visualize. This table provides you with the names of the counties going from the lowest to the highest, and it provides you the county, the source, the measurement period, and once again the measurement indicator. So if this table is something you're also interested in, you can also always download the table as an Excel format sheet. At the bottom of the page, it gives you some information as it relates to the number of counties, the lowest rate, the highest rate, and those that falls in between as well as our median rate for the region. Once again, at the bottom of the page, it provides you with the source that this information is coming from, and if that information is something you're interested in, at the top of the page, it provides you with the source, with the source where the information is coming from, and as well as the last time this information was updated. So this site really gives you a great sense of what it can do when it comes to the type of data you would like to extract. In this given case, we use heart disease as our primary indicator as an example. And if you're looking for any other indicator, the steps that I went through is the exact steps that you can go through to get the information that you're looking for. And each page will be displayed the same way as this page is displayed. Now, at the bottom of the page, what the link tries to do, or the website tries to do, is to link several items that associates with the indicator you're looking for or the data you're looking for together as well. So at the bottom of the page here, we have a section here for indicators, and this section here shows the other indicators that relates to heart disease that perhaps you would be interested in expanding and looking at the rates. So for instance, age-adjusted rate of high blood pressure prevalence. So what the site tries to do is also provides you with similar factors and indicators that could be related to your data or your primary indicator of interest. So a question came in, but for some reason we can't seem to find it, and I think it came from Bree, right? So perhaps she typed it. We just saw the question again, but we still cannot see it. I don't know what's happening. Well, anyway, Michael and Zoo is very best to grab that question, and Bree wants. Here we go again. For us to get into this. Okay, we'll do our very best to grab that question and answer that question. So going back into this page, next to the similar indicators is a promising practice option or section. So as we all know, for most of us who has been part of the child process, one of the main priorities is to identify programs and interventions that you can implement and promote in your community. So what this page does in terms of the promising practice is to give you a sense of what other people are doing around the country and in the community when it comes to programs that people are implementing to combat the issue of heart disease. So here we got the question. Okay. Okay. So the question speaks to what is the best way to download these table charts and maps in a format appropriate for insertion into the chart report. So we briefly went over this, and I'll go back into this again. So, for instance, if you're interested in this graph here, if you select this line graph and put your cursor onto this line graph, this hamburger, once again, will display itself. You can expand this menu and choose to download this, specifically just this given graph, as a JPEG or as a PDF. So this is the best way that you can capture or download the graphs and the tables that we have here on the page. And I hope that answers your question, Bree. And you can do the same thing with the bar graphs as well too, as is showing the 8 counties and where the 8 counties fall. So going back to the best practices, so as a community, once you complete your data analysis, you identify your priorities, then you identify programs that you like to implement. What this page attempts to do is to shows you what other organizations and other agencies in the community or around the country are doing in terms of establishing and implementing programs to combat heart disease and heart problems. So if you can select any of these programs and see what the organization, who the organization is, and what you're doing. And so I'll go ahead and select the very first one that says Better You, and I'll open this as a new tab. So once you select this one, so the one that I selected was the Better You option, which is a program. So it brings you to this page. It tells you the type of program. So this is an evidence-based practice program. It will provide you a description of the program, the goals and the mission of the program. If there is any results that the organization have, will give you the results and the accomplishments of the program. And most importantly, it will give you the organization that implemented the program, and it give you some contact information that you can reach out to these individuals and try to get a sense if this is a program that interests you and you would like to implement a similar one, that you can reach out to this organization and get a sense of how it was done, and maybe collaborate with this organization in terms of helping you start the program. In most cases, programs that we implement for conditions in our community, it's already been done, or it's been done across the country or within our own community. And instead of reinventing the wheel, you can simply just reach out to one organization, and they will walk you through the process and make things a lot easier. And since you know it's been already done, perhaps you don't have to make the mistakes that organization made in the past in order to get the results that they received. So going back to this page, so this once again, this is how you can grab data and how you can get data, and it's a great way to come to this site and simply, as I said, simply search by a keyword and get the information that you're looking for. So when it comes to getting demographic information, so most of our reports we have to include in our reports that are submitted to the state the demographic information of our counties. Once again, if you visit the dashboard tab, the second option to the top is Find Demographic Data. If you select that, there's a page that shows up here with the 2018 demographic information. Since I used Chautauqua in the past, I will go ahead and use Chautauqua as an example for the demographic information as well. So if you come to this page, there's a pull-down table here that gives you at what level and the information you can get. So there's state information, regional information, county information, zip code information, and I believe census place information as well. So I'll go ahead and select Chautauqua as an example. So when you do that, it gives you this page with several different tabs at the top, and if you scroll down the page, you get a sense of the demographic of your population and of your county. So for Chautauqua, this is the number of people that currently reside in Chautauqua as a county. There's a comparison rate to the region and the state. There's a percent change in population size from 2010 to 2018. So as you can see, there's a decrease in our population size since 2010. We get a page here. We get a section here, population by race. There's a beautiful graph here, a pie graph that chart that shows you where the races fall, as well as a table here. If, as I mentioned previously, if a table is something that you like and helps you visualize a lot better, it gives you a sense of where the races fall in the breakdown of the demographic information based on our population. There's population by ethnicity. It's very similar to the one by race, as well as there's a table attached with this beautiful part, this beautiful chart over here. There's a population by age. You can get a good sense of where the majority of our population falls. And as you can see here, the majority of our population falls within that 25 years to 64 years old population. So these tabs and these sections, and as well as a table with the breakdown of the ages. So this page will give you a sense of where your population falls, and as well as your if you're writing your report and you like to include some demographic information into your report, you can always visit this page to get a sense of how the reflection of your population and incorporate that information into your report. Now, as I mentioned previously, you can always, if downloading the chart and you want to or graph and you want to include that into your report, you can always expand the menu and download it by JPEG or PDF and insert that into your report. So you always have the option of just downloading it as a table or downloading it as a graph, or if you simply just want to grab a few indicators as it relates to your demographic information, you can just simply write those down and incorporate those into your report. So in this section of SWOT, there's a population by sex based on your male and female population. Now, the reason why this information is so important is because very often when we do our community health assessment, you want data or you want an assessment that reflects your population. So, for instance, you complete your analysis and you realize that more female answered the surveys than men. You can come here and compare those rates. Some of the earlier rates that I've been seeing for some of the counties that I have been working with for the community assessment, we have as many as 80% of our female population right now that's completing the surveys to about 20% of our male population. And that's not really a good reflection of our population when it comes to the assessment. So that's where the mid-data analysis really comes in, and that's where that mid-data analysis is really important, because you can take that information, compare it to the actual demographic information of your county, see the reflection of it, and see if there's if it's representative of your population. If it's not, then you can go back and do take a different approach and push out the survey again specifically to the population that you would like to target. So this page is really helpful in the sense of getting that demographic information that you need. So it gives information anywhere from gender to sex to household income information as well. So you're welcome to always to visit this page and get that demographic information that you're looking for. So very often the question that I get is if you want to grab multiple indicators at a time. So let's say, for instance, you're not just here to extract one data, but you're here to extract multiple data at a time. How, instead of grabbing one indicator at a time, is there a way that you can compile all that data and print it out as a report? And we do have that option on this site as well too. So if you go into our Western New York reports section, at the bottom of the page is a create report tab or option. If you select that option, it brings you to this page titled Location Report Builder. And there's this pull down here, once again, at what level of information you can get. And since I want to remain consistent, so I'll use Chautauqua as an example once again. So if you select Chautauqua as your primary county of interest, as your primary county of interest, you have the ability. So there are tabs up here in terms of indicators, demographic information, and social needs index information. So you have the ability to grab multiple indicators at a time instead of just grabbing each one at a time and printing them or downloading them. So what this page allows you to do is to incorporate multiple indicators at a time into one page and print it out. So if we go into our indicator tab, you can always once again you can search by keyword. So I'd like to remain consistent with what we've been discussing. So I'll choose heart disease here once again. If you choose heart disease, once again you will get all the indicators that relate to heart disease. So once again, we'll use age-adjusted death rates due to heart disease. If you select that option, you have the ability to select any component that you want. So do you want to select the chart by gender? Do you want to select based on change over time? Do you want to select based on a comparison rate? So you have the option to choose as many components as you want. So I would just do the change over time, the gender subgroup, and I'll do one or two comparison rates, so comparing to trend and New York State value. And if you select add, what you see here now is you essentially build your own report. You can move these items as big or as small as you want them. You can take them and reposition them and move them wherever you want to. And so it gives you a really good sense of, I can come here and build my own report instead of grabbing everything one by one from the site. So I'll go ahead and do another example here. So I'll just put in obesity as an example, and we get, once again, you get indicators that may relate to obesity or factor into obesity. So I would use age-adjusted rates of adults who are overweight or obese. If I select that, you get a great sense of what component you can use again. So I'll do change over time. Once again, compared to a New York State value. So I'll just do 2 at this point. And if you add those, once again, you get you get the line graph with the comparison rate. And you can do the same with the demographic information as well too, right? So this is a great way to come here and get that information that you're looking for, build that into just one basic report and print that information out. So once you're done, you can always save it as a PDF and print it, or you can save it onto the site as a temporary document and come back and work on it again. So you have several options here in terms of how you would like to build your report and print that report and display that report. So those are the basics in terms of getting data and how you can grab that data into your report, and you can get the demographic information as well. So we have about 10 minutes left, and I'll use about a minute of that time to briefly touch on the child guide. So if you go into our resource tab over here, there's a community health needs assessment guide. Oh, are you sure you want to leave page? That is strange. Okay. Yes. Oh, of course I did. So if this page for people who are doing the community health assessment process for the very first time. This is a great page to visit because it will give you a step-by-step approach to how you can conduct your assessment. So I will just use one of these tabs since we are almost running out of time. One of these tabs is an example. So assets. If you select assets, it gives you several tabs up here. So how you can define and understand your service area in terms of your population, how you can analyze your data, how you can gather community input, how you can determine your significant health needs, so in this case, identifying your priority needs, how you can understand your community resources, so how you can basically partner with your organizations in the community to come on board with your community health assessment needs, and how you can evaluate the process of your data to date. Now, if you come to the bottom here, the steps are, as I mentioned, the steps are laid out here, and you can expand all of the steps, and it gives you a step-by-step approach in terms of how you can conduct your community health assessment needs. So I'll just use the first step as an example. Step one, how you define your service area. So in terms of your county, your geography, we just went into how you can grab your demographic information. So what part of your population do you want to see represented into your community health needs? And this step tells you what approach to take. Is there any specialized target population that you like to include into your population? So there's so much that you can think of that you like to incorporate into your child process. And this page, I think this page is a really great source, especially if you're only doing this for the first time or you're joining a group for the very first time. You can visit this page, and this page will give you a step-by-step guideline and educational tools in terms of how you approach that. So if this is your first time that you're doing a community health assessment, I really encourage you to visit this site, and it will take you to other sites as well to in terms of getting more information. So once again, if this is the first time you're joining a group to do this, I recommend that you visit this page to do so. So with the last 7 minutes left of our time, I would like to go ahead and take questions if you have any questions that you have, and I will take the questions at this point. And once again, you can type the questions into the Q&A box. Once again, thank you everyone so much for joining us this morning. So as I said, if you have any questions, you can input those questions. If you don't, then it looks like this is the end of our discussion and of the webinar. Thank you so much for joining us. If you have any questions after this, you can always email me. I'm always available to come into organizations to do a demo of the Keystone website. So if you are within our region, our Western New York region, and you'd like for me to come in and do any personal demos and presentations and provide a truly in-depth presentation of the site, you can always email me, and my email information would be. A question just came in. So the question asks, do you have any data on who has or doesn't have insurance by zip code? Yes, we do. And this question is coming from Deb Nichols. Yes, we do. So Deb, if you visit our site, if you go to the Find Health Data, that question is from who? It's from Deb. This question here is from Deb. So once again, you can search search health insurance. You get an option here for health insurance by zip code, and you can there's all the zip codes are represented here, so you can go through the list of the zip code you're looking for, and I will expand this as well too. So I mean, obviously, obviously you don't want to use this bar graph over here because it doesn't really help you as much. But this table here does. So you can download this table here, Deb, and if you download this table, you can get a Excel table, and you can filter and determine which ones of the zip codes you're interested in and grab that information. So yes, we do have that information when it comes to zip code by health insurance by zip code. Oops, and by age. Health insurance by age. Health insurance by age, I can get that information for you, but at this point, it's not represented on Keys to Health. That is something that I can get through the American Community Survey. So if that's something you're specifically interested in, I think this question came from Nola. I can get you that information personally, and I've always said this in the past. If there's any local information or local data that you need that is not represented on this website, you can inform me, and I'll go ahead and upload that information onto the website as well too. So if health insurance by age is something that people are really interested in and people need, I can always upload that information, so that makes it easier for people to go up there and grab that information. But no, I can get that information to you personally if that is something you're looking for. If you give me the specific zip codes you're looking for, the specific zip codes you're looking into, I can always get you that information. Do you have any information about when the prevention agenda update is due for that is due December 28th. So this question is coming from Nola, right? Do you have any information about when prevention agenda update is due for the CSPs/hospitals? That is due December 28th. Okay, so folks, it seems like it's 11 o'clock. Thank you once again. Thank you so much for joining us. And if you have any questions, you can always shoot me an email, and I will respond to those questions. So once again, thank you so much for joining us this morning.